7 popular medications that cause liver damage. Hi everyone, did you know that excessive use of medications in everyday life can cause serious damage to your liver and potentially lead to death? It turns out that overuse of certain medications can pose a significant threat to your liver and, in extreme cases, even be fatal. In this video, we will explore 7 common drugs that may cause liver damage, emphasizing the importance of avoiding overuse. The role of the liver. What does the liver do? The liver holds a pivotal role in maintaining overall health as it carries out an array of critical tasks, over 500 to be exact. Some of its primary functions include the detoxification of harmful substances, storage of essential vitamins and iron, production of bile for digestion, and, most pertinent to this discussion, the breakdown and metabolization of medications. Despite its remarkable ability to regenerate and repair itself, the liver isn't invincible. It is highly sensitive, especially to harmful substances and specific medications that can overtax its capabilities, leading to potential damage. This is particularly concerning as the liver's health directly impacts its ability to perform its crucial roles, emphasizing the necessity for careful medication management and regular monitoring to maintain optimal liver health. Why the liver is vulnerable to medication damage. While you indulge in meals, beverages, and pharmaceuticals, your liver plays the role of an unsung hero, diligently filtering these substances, storing essential nutrients, and disposing of waste. This continuous metabolic activity substantially raises its susceptibility to encountering detrimental agents. Numerous studies suggest that various medications, including herbal remedies and dietary supplements, can escalate the probability of causing harm to the liver. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. With that said, let's delve into 7 medications that in excess can cause liver damage. 1. Acetaminophen. Acetaminophen, often recognized by the brand name Tylenol, is a commonly used over-the-counter drug known for its effectiveness in relieving pain and reducing fever. This ingredient is not only present in Tylenol, but also in a multitude of cold and flu medications, making it easy to consume inadvertently in higher quantities. While it's generally harmless at the suggested dosage, consumption beyond the recommended levels can have serious repercussions on the liver. Overdosing on acetaminophen can potentially lead to acute liver failure, an urgent condition that requires immediate medical intervention. To prevent this, always adhere to the dosing instructions on the packaging. Additionally, if you're taking multiple medications, be cautious as acetaminophen might be a hidden ingredient in many of them. Make it a habit to check the ingredients of your medications, and when in doubt, consult with your pharmacist or doctor. 2. Statins. Prescribed extensively to control high cholesterol, statins such as simvastatin and atorvastatin are generally safe for use. However, in certain instances, they could trigger an upswing in liver enzymes, signaling potential harm to the liver. Even though the occurrence is rare, individuals prescribed statins are advised to undergo regular liver function examinations to track any impending liver damage. When used responsibly and under proper medical supervision, the benefits of statins for managing cholesterol levels often outweigh the potential risks. Still, vigilance in tracking any unusual bodily responses while on statins, such as fatigue, loss of appetite, or abdominal pain, is critical. If you experience any of these symptoms or routine blood tests show elevated liver enzymes, your healthcare provider may adjust your dosage or suggest an alternative treatment. The key is to maintain open communication with your pharmacist or doctor and follow the prescribed regimen accurately. By doing so, you can effectively manage your cholesterol levels while maintaining a healthy liver. 3. Non-steroidal anti-inflammatory drugs, NSAIDs. Commonly used for the treatment of pain and inflammation, non-steroidal anti-inflammatory drugs, or NSAIDs, can potentially pose a threat to liver health if misused. These drugs, which include familiar names like ibuprofen and naproxen, are often a go-to for relief from minor aches and pains. However, their potential for causing harm increases with regular or excessive use. Prolonged intake of these drugs can potentially induce a condition known as drug-induced hepatitis, a form of liver inflammation. In severe instances, this can progress to liver failure, a life-threatening condition. Hence, responsible use is key with NSAIDs. Adhere strictly to the recommended dosages and be sure to seek medical guidance if these drugs are required for long-term use. Regular liver function tests can also be beneficial for monitoring the impact of these medications on liver health. 4. Antibiotics. Antibiotics, a common and necessary medication, can paradoxically pose a risk to liver health. Certain antibiotics, such as amoxicillin clavulanate and isoniazid, have been linked to liver damage. These issues are typically associated with extended antibiotic use, but in some instances, they can arise even after a brief duration of use. Being vigilant about your antibiotic intake is critical to mitigating potential liver damage. Ensure that you strictly follow the prescription instructions. If you observe any side effects such as fatigue, loss of appetite, or abdominal discomfort, immediately bring them to your healthcare provider's attention. Even though antibiotics are generally safe when taken as directed, these medications can interact with others, elevating the risk of liver damage. Therefore, if you're on other medications, it's prudent to discuss potential drug interactions with your doctor or pharmacist. In this way, you can benefit from the life-saving attributes of antibiotics without jeopardizing your liver health. 5. Antidepressants. Antidepressants, a critical component in the treatment of various mood disorders, may also have potential adverse effects on liver health. Certain types of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and tricyclics, have been linked to instances of liver damage. This risk appears to be amplified with high doses or concurrent use of other medications. For those individuals on a long-term antidepressant regimen, regular liver function tests are highly recommended. Monitoring the liver's health allows for early detection of any adverse effects and facilitates prompt medical intervention if necessary. It's also important to be cognizant of potential signs of liver distress, which may include symptoms like fatigue, loss of appetite, or abdominal discomfort. Communication with your healthcare provider is a crucial component of managing the potential risks associated with antidepressants. Always disclose all the medications you're currently taking to your healthcare provider, including over-the-counter drugs, as these may interact with your antidepressants and potentially exacerbate the risk of liver damage. If you notice any side effects or unusual bodily responses, bring them to your doctor's attention immediately. Remember, your medication regimen can always be adjusted to balance the need for effective treatment of your mood disorder while safeguarding your liver health. 6. Antipsychotic drugs. Antipsychotic drugs, vital in managing severe mental health disorders like schizophrenia and bipolar disorder, unfortunately, carry a risk of potentially causing drug-induced liver injury. The pharmacological components in these medications can strain the liver, affecting its ability to function optimally. Regular monitoring of liver enzymes is a crucial step for those prescribed antipsychotic medications. Such tests can help identify any potential issues early on, enabling prompt intervention if liver damage begins to occur. If you're taking antipsychotic drugs, be mindful of symptoms like fatigue, loss of appetite, or abdominal discomfort, signs that could point toward liver distress. Discuss any changes in health promptly with your healthcare provider. Always ensure to provide your healthcare provider with a comprehensive list of all medications you're currently taking, including over-the-counter drugs and supplements, as some of these may interact with antipsychotics, heightening the risk of liver damage. If there's any concern, your healthcare provider may modify your dosage or suggest a safer alternative. This balanced approach allows for the necessary treatment of severe mental health disorders while simultaneously minimizing potential harm to your liver. 7. Anti-convulsants. Anti-convulsants, crucial in managing conditions such as epilepsy and specific types of nerve pain, can potentially have adverse effects on the liver. Certain types, like valproic acid, have been linked to severe liver injury, especially when started in early childhood or infancy. However, it's important to note that this occurrence is relatively rare. Nevertheless, regular liver function examinations are essential when taking these medications. These checkups can help detect any potential liver damage at an early stage, allowing for immediate medical intervention if necessary. It's also prudent to be aware of symptoms that might suggest liver distress, including unexplained fatigue, diminished appetite, or abdominal discomfort. In the event of experiencing such symptoms, contact your healthcare provider promptly. In the interest of managing potential interactions, it's also important to share a complete list of all your current medications, including over-the-counter ones and supplements, with your doctor or pharmacist. With this comprehensive information, your doctor or pharmacist can ensure the most effective and safest treatment regimen for your seizure disorder or nerve pain, while also minimizing potential threats to your liver health. Thanks for watching. If you enjoyed this video, comment, subscribe, and click on the bell icon so you never miss a video. We wish you all the best for your health and well-being.